Hello, everyone. Today I'll be delivering a presentation titled I Want to Be Represented, Community Perspectives on Disaggregated Race Ethnicity Data Collection in Healthcare Settings. For some context, in 2022, my team at the New York Academy of Medicine convened a series of focus groups with diverse community members to support data disaggregation efforts across New York State. As part of these efforts, NYU Langone was working on developing tools and systems to disaggregate race ethnicity data collected, and to make sure that community input informed their work, they enlisted my team's help. Together, our teams developed a qualitative study that sought to gain perspectives on racial ethnic identity and common racial ethnic categories, preferences for reporting race ethnicity across settings with a focus on healthcare settings, and recommendations for race ethnicity data collection. We conducted a total of 13 focus groups and one key informant interview with 81 community members from different racial ethnic groups across New York State. The breakdown appears on the screen. As a note, the group with Native Hawaiian Pacific Islander identifying individuals was conducted with people outside of New York State due to challenges recruiting individuals who identified as Native Hawaiian Pacific Islander and resided within the state. In terms of findings, we saw that participants describe themselves in different ways across and within the racial ethnic groups. Participants also discussed how the way they describe their race ethnicity may actually change depending on who they're speaking to, and how sometimes, despite their personal preferences, their identity may be defined for them by others. These findings are illustrated in the first quote on the slide. Additionally, across groups, participants said it was appropriate and important to provide race ethnicity information in health-related contexts, mostly as this information may improve quality of care and be used to better understand and serve communities. As a result, individuals tended to be receptive and eager to answer detailed race ethnicity questions in this context, whereas they described being uncomfortable in other settings, such as when completing job applications, due to fear of discrimination, for example. People's comfort providing race ethnicity information in healthcare settings is illustrated by the second quote on the slide. When asked how racial ethnic questions and categories could be improved, a few consistent themes emerged across groups. People said that questions about race ethnicity should be simple and clear. They also said there shouldn't be too many answer categories and that they should not appear arbitrary, since seemingly arbitrary options might result in people feeling excluded. This is illustrated by the first quote on the slide. People also recommended that race and ethnicity be combined into one question. Across groups, participants preferred having Latina identity listed alongside all other identities. This is illustrated by the second quote on the slide. Furthermore, given the intersection between race, ethnicity, and national origin, people also believe that when answering race ethnicity questions, respondents should be able to provide additional detail. They should be allowed to choose more than one answer category and write in additional detail about their identity. Lastly, participants recommended that whenever race ethnicity questions are asked, information be provided about why they're being asked and how the data will be used. Participants believe that this would encourage respondents to provide more detailed and accurate information. Earlier this year, the Office of Management and Budget issued updated standards for the collection of race ethnicity data. The federal government now requires the collection of additional detail beyond the minimum race ethnicity categories. Findings from this study highlight important perspectives from diverse community members and should be considered as updated race ethnicity questions and disaggregated categories are developed in line with the new standards. Thank you all for listening.